Harvey, the Associate Dean for Research here in the college, and I'm just delighted to see all of you here in person. And I also welcome all of you who are joining us remotely. This is our third research seminar this quarter, and I'm delighted that we have a very wonderful alumnus joining us. And I did want to tell the students, remind you again that there will be a Q&A with the presenter following the seminar. So it'll be right here. And if you're coming in remotely, just stay on the Zoom. Okay, with that, I am delighted to introduce Carolyn Aldwin. Carolyn is a professor in HTFS. She's also the director of our CHAR, our Center for Healthy Aging Research. So, and I think she has a special relationship with our speaker, which she'll probably talk about. So please join me in welcoming Carolyn.
Thank you very much. Welcome to the College of Public Health and Human Sciences Friday Research Seminars. I want to let people know that because we're on Zoom, we're probably going to leave the questions till the end. And so, unless it's a clarification, but for those of you on Zoom, you can put your questions in the Q&A, and I will be monitoring this, and will then relay the questions to Jeffrey. Right? Any questions about procedures? No, great. So it's my distinct pleasure to welcome Jeffrey Proulx back to the campus. Jeffrey was actually my doctoral student not that long ago. And he was really, really great while he was here. He was a Ford Fellow. He was very adept at gathering funds. So we got a diversity supplement to a grant I had. He graduated in 2015 and then went up to OHSU to the T32 training program and got some research money up there and is now at Brown University at the Center for Mindfulness. And also you're affiliated with all sorts of other things, anthropology and psychiatry and and also running some of the diversity initiatives as well. So, and he's been working with Native American communities as a Native American himself, a Mohawk, and doing wonderful work looking at mindfulness and incorporating it within traditional cultures. So the title of his talk is Exploring Native American Approaches to Mindfulness, and I will turn it over to Jeffrey. And thank you so much, Jeffrey, for coming.
Thank you, Karen. Sometimes it's just easier to hold on to these things. So can you hear me okay?
You can take your mask down while you're talking.
I feel so free. Anyways, yeah, thank you so much for coming. This is a distinct pleasure, obviously, for me. Coming back to Oregon State, it was really nice to just travel around campus. It's so beautiful out right now. And here, go beat Utah. Go Beats. I'm sorry. Going to see some football tomorrow, so I'm pretty excited. Anyways, my name is Jeff Proulx. I'm an assistant professor at Brown University primarily in public health. But I'm also have an appointment in psychiatry, Department of Medicine, and in Native American and Indigenous studies at Brown, and in contemplative studies at Brown. And the reason that I have so many different contacts at the university is because of the nature of my work. So I came out of the public health school at Oregon State University and went on to work at OHSU because my interest is in the health, particularly in this case with Native American populations. But one of the things that I've noticed about health and health disparities in Native communities is that so much of it is due to the loss of culture in a lot of these communities. And so, and the health disparities that we look at, in particular, some that I'm mostly interested in, whether it be violence or in diabetes or dementia, cardiac care, heart disease is the #1 killer of Native people. So, but all of these different conditions that I look at and want to treat are all exacerbated and in some cases caused by stress. right? And some of the stress that we're interested in is cultural, is historical. And so my research has been looking at approaches of dealing with Native American health, but particularly from a Native perspective. Because one of the things, and I'll go ahead and talk more about this in the presentation. And so what I'm going to talk about today is some of the steps that I've taken in my studies, because particularly what I wanted to do is go back and retrace some of the steps that we did, because what's the most critical part, I think, of this presentation is the Native American part, is that if we can get these communities to voice their needs and what their type of feeling are, and if we can take that information, and my approach is to take the words from the communities and bring that to the National Institutes of Health, rather than the other way around of having NIH prescribe some sort of intervention or treatment or pill and see how well that works in the communities. Is my approach has been looking at the communities and having them tell medicine what it is that they need. And so this particular there's been, and how many people are familiar with mindfulness in general? Pretty much. Okay, yeah, it's pretty ubiquitous. And so in the mindfulness community, we use that oftentimes to deal with, to focus on stress. There are a lot of interventions that people have developed over the years to address stress, to address eating disorders, to address depression. Mindfulness is pretty well known, and people have been using it in a clinical setting for a number of years. But more recently, one of the things that we've noticed in the mindfulness community is that it seems to be very white. It's very much geared towards a particular population of people. And so people of color and people of BIPOC communities, and I've heard this directly from a lot of these communities, don't always feel like there's a place for them in this whole mindfulness concept, right? And so a lot of folks just don't turn to it because, and people say it directly, it's just not for us, right? So one of the things, the community has been making more of an effort to reach out to underserved populations and to reach out to other groups. And up here, there's just a different, the Insight Meditation Society, Spirit Rock Education Center on the West Coast. A number of these different places have taken broad efforts to open their doors. This is how I look at it. They want to open their doors and be more welcoming to these communities. But the problem is it's still dealing with a cultural issue, right? Are people wanting to come in? You're opening the doors, but are you making these interventions more appropriate for these people? Are you dealing with the stressors that they're dealing with? And that's where my concern is it's nice that the doors are open, but are you creating an opportunity for people to express their truest selves in that mindfulness concept, or are you making them more white? And so a lot of my work has come from this concept of is influenced by community-based research, participatory research in particular, or community-based action research as well. But because CBPR is a very precise term that really that focuses on the community. The community driving the research questions, the community driving where the research goes. And so I've found that sometimes difficult to actually do, because usually I come in with a lot of expertise that they don't have, or money, or, and so oftentimes I have to be very much the person that is in, organizing, guiding how these different things go. But then I provide opportunities for people to speak through that work. And what that does, it gives me an opportunity to engage from the community, to learn from the community. And what we've found over time is that any intervention that you want to do is just going to have, especially with underserved populations, is going to have much greater success, much greater likelihood of success if it's been created by that particular community. Understanding the history of the community, this all goes back to this whole concept, and with Native communities, this idea of intergenerational trauma. Native people in psychology in particular have noticed that there's, for whatever reason, trauma has been passed across generation to generation, and it's a phenomena that people haven't really had an opportunity to completely understand. We have ideas about it, but one of the things is that trauma influences how people live their lives and how they experience stress and how they experience difficulties. And so understanding that history is really important to be able to create interventions or be able to create programming that takes that into account. And so understanding that history is really important. And we get that by working with the community members, not just by reading a book, but by finding the right people, the knowledge holders, the medicine men and women. You know, these are the people that would teach you about the traditions and the histories and the stories and the traumas that they faced. And also being able to think about psychosocial phenomena and how we measure them. They could look a lot different. You know, we have a lot of scales that are validated by first and second year psychology students, you know, at some university somewhere. And a lot of these different scales have been validated with populations that that may not be Native or may not be African American. And so one of the things that I've noticed is a lot of these people in different communities have things that they are stressed about. I've worked with African Americans in Portland, Oregon, developing mindfulness programs there, and people say, you know, there's no context of like dealing with gentrification and loss of communities, or dealing with that shuffling that Black people have had to face in the city of Portland, and what the stressor is. You know, that type of stress, the structural stress, isn't included in these types of interventions. So my work has been thinking about, you know, from the community-based aspect of asking people, what is it that stresses you? Why does it stress you? What are the different things from your perspective that we need to focus on that would help to, you know, help with your life, not the lives of whoever these stress measures were validated against. And I already mentioned that, you know, when we're thinking about, and from my perspective, going back in intervention development with mindfulness, is I always wanted to have some sort of idea of how do we address intergenerational trauma in this type of intervention. People have looked at intergenerational trauma, and like I said before, it's associated with lots of different very poor health outcomes. And a lot of these that we're looking at up there are associated with stress or exacerbated by stress. And so my hypothesis is if we can develop interventions that can help to ameliorate stress, then we could deal to reduce the physiological responses to stress over time and be able to address some of these particular issues. Because we know, like for example, diabetes. Diabetes there's a physiological component to increased levels of cortisol, and that insulin's not as easily, the uptake isn't as easy. But then there's also the psychosocial stress of just dealing with diabetes and the type of health behaviors that are involved in that, and how stressful it is to actually manage diabetes. It's a lifelong effort in health behaviors. And so all of that stress that we know increases poor health behaviors that people end up using. And over time, that can develop into further other health outcomes. And in my case, I'm particularly interested in vascular dementia. And so if we can address some of these diseases at the earlier stages and have people working on health behaviors and good healthy health behaviors early in life, we're hoping that could ameliorate the long-term effects of some of these diseases. And aging is really where my heart is. I've had to go back because I'm mostly interested I have a deep interest in later life issues, but the more I look at later life, in particular diseases, is where I've kind of landed. I look back in the life course and I can say, well, there's probably things that people could have done earlier that would have prevented this from happening later on. And so that's where a lot of my emphasis on now is looking at what are the developmental processes that we can address at certain points along the lifespan that might have a better outcome later on. And there is some limited intervention that suggests that mindfulness may be the stress reduction effort that could really work with Native people. And I'm a psychologist, and so my background in psychology was really focused on, early on was on treatment for Native people, and the research strongly suggests that culturally centered treatment is really is a very good way to go for any kind of clinical experience for Native people. The reason that is it provides a foundation for meaning and purpose. People can understand their culture better than they understand medicine, right? There's a whole lot of different ideas that are different in medicine than it is in traditional culture. So we like to try to, if we can, try to bring in ideas of like reframing a whole health intervention from the perspective of the medicine wheel, or thinking about the 4 directions. I've been asked to bring in medicine men in the past, or we'll try to do any kind of discussion, any sort of group discussion that we're involved in any type of therapy, but doing that in a talking circle, right? And then setting it up in a way that people know how to communicate with each other and feel safe, and they feel like they can be earnest about their discussion. So we might set up a talking circle rather than just having it set up as just like group therapy or something. So there's all these different ways that traditional treatment, the traditional elements can be brought into the treatment. And that's very much what I'm interested in doing. So, and here it comes in my career, kind of an interesting thing, because I had, before I met Carolyn, as Carolyn knew, I was very much interested in researching and being involved with mindfulness practice. And the school down the road didn't like that very much, which was kind of interesting. They said, you can do everything else, just not the mindfulness part. When you graduate, you could. So I came here because, yeah, I came up here and I met Carolyn and Karen, and they're like, you can do that. In fact, Karen took me down to go see Rick Levinson. You got to see this guy. So I said, this is my home right here. But somewhere along the way, I was very much interested in mindfulness, but I'm also Mohawk, as Carolyn pointed out, so very much interested in traditional treatment at the same time. So mindfulness is not a traditional treatment for Native people. So then I was kind of stuck. I'm like, oh, because I don't want to be the one saying, well, do the mindfulness, but do the traditional at the same time. So what I've started to do is look at traditional treatment or traditional elements of Native culture that are already mindful, right? And starting to think about, and we can go over some of these things, but where do they overlap? And how can I be able to bring in these cultural elements into a mindfulness practice? Because what mindfulness does, at least, is it gives us a nice structure. I teach mindfulness-based stress reduction, MBSR, which is an 8-week course that has a specific curriculum. Each week you do the same thing. Everybody around the world does pretty much the same course. So given that I know that course very well, and what I could do is be able to look at each one of the components of that course and say, okay, here's this movement section, right? What in Native culture is a correlate to that I could bring into that we could practice instead of doing mindful walking. Maybe we could start bringing in Native dance into some of these different things. So when you get to the mindful walking part of the intervention, instead of doing what they would be doing in the MBSR class, they're doing Native dance and the issue here then is that there's well over 500 nations federally recognized in the states. So in dealing with the diversity of Native nations, I didn't want to create something that was quote unquote pan-Indian. And so I wanted to create something that would give flexibility so each Native nation, that their diversity of attitudes could be brought into the intervention. So once again, not an easy place to be because there's 500 different nations. But I think that as we were having these discussions and, at the university, and I was meeting more people in different communities, is that people started to, and because of this community-based approach, I was feeling all of this stuff out with different communities at Navajo, with here in Klamath Tribes and United Indian Health Service. I was just and different scholars in Canada and the United States, and people started to get a sense of what it was that we were creating here. And people started making some contributions. Tao Lee and Gobert were one of the earlier people who started actually doing actual mindfulness practice with Native tribes. And they were invited up to a tribe in Montana to work. This particular group had been pushed to the limit on youth suicide. And they thought maybe mindfulness might be something that could be a good approach. And so they went up there and they spent a lot of time prior to developing this course working with the elders and working with the storytellers. And that taught me a lot about that preliminary footwork that has to go into making these relationships and developing the trust, and I think I can't get through that, emphasize how important that is. And then Tao and I did a similar study in Hawaii where they had introduced with incarcerated teens, introduced a mindfulness program that had brought in aloha. And so I'm the wrong person to really describe aloha, but it's an overall philosophy of peace and of brother and sisterhood and personhood with everybody around you, right? So it's a Hawaiian perspective. And so she wanted to bring that into the intervention, and they did. And what they found is that the youth were they were really excited about it. Everybody said that they would continue to use it. Most importantly is the the Department of Corrections said the youth were much better afterwards. I think that's was their original goal, is like, how can we calm these teens down? But what we found is that they had much better responses to stress, and we also started to see some changes in both cortisol and immune system response to stress. So they were both reporting that they liked the intervention and they wanted to come. It helped them psychologically, but also we saw some physiological changes as well, suggesting that mindfulness and bringing this, something that we're doing here is getting underneath the skin, right? And is affecting kind of how our physiology responds to different stressors. So that was exciting to us. And as I went on, so we had a few studies under our belt. I started to get interested in doing this in Navajo, and this brought up a couple of big things I wanted to talk about when doing research in Native communities. I really had to do my homework about what type, not just the history of the community, but the history of the research that had been done there. And this was an interesting thing is I went to Navajo and we were going to propose that we collect saliva, not blood. But either way, we were collecting biological sample in Navajo. And I landed and I was taking my bus ride up to Flagstaff to go over to Navajo. And it was a newspaper article about how one of the Native tribes in Arizona had just sued Arizona State University for a tremendous amount of money. They made it hurt. The judge made it hurt because they had reanalyzed some genetic data that was in their that they had on the shelf without any consent for that, without any knowledge, and so on. And so it was a major issue of Native people feeling extremely abused by the academy. And so I was like, oh, and I'm going to go to Navajo and go, can I have some biological samples? So it gave me an opportunity. So I thought about it and I said, well, I got to be prepared for this because I was going to meet the IRB the next day. And I was going to say, I'm going to get biological samples and we may end up wanting to ask for blood later on. And they were totally fine with it because I had come prepared. I said, well, what I'm going to do ahead of time is we're going to have an arrangement that whatever samples that we take, we're going to get the data and we're going to have it destroyed immediately. So that way there's nothing left on the shelf, and for them, that was really important because it showed that I was paying attention to like what their experiences were. And they approved me that day. And Navajo IRB is not an easy get. Ask Harvard. The Harvard and Hopkins have a big presence out there. So if you go to their IRB, you'll see their people getting yelled at by the IRB, but they like me. So, but I think they like, and I probably that liking me had a lot to do with me taking the time to figure out, how am I going to take, what could be their concerns ahead of time and already having an answer for that. And so these are kind of some of the things that and some of these other things up here, involuntary experimentation. You've all taken the RCR course, I hope by now, but there's been a whole series of, the academy and medicine has a whole long history of abuse to underserved communities. And so I think understanding that, and that's the perspective that a lot of these people are taking, right? That they might be looking at me as a representation of that. And so I want to make sure that I don't, that they're clear that I'm aware of all that stuff and I care. And so that all goes into, I think I can't say enough about, and this is a lot for people who might be interested in doing similar work, is get that community commitment, and a lot of that that's how I got that community commitment, is I knew the history. I had looked about different research issues. And when people see that, they generally like the ideas I have. It's not about whether or not the idea is good. It's about what's that communication, what's that relationship going to be like between me and the community. And so that's why I had to be really clear is that, I'm an advocate for the privacy of the community. One thing came up, I was at OHSU when I was doing the Navajo IRB, and OHSU being a hospital means HIPAA. You got to get a HIPAA thing signed. So I was preparing the HIPAA form, and the language in the HIPAA form was exactly the opposite of what the tribe had said. Some of the things that they say that they could do with your data, with your biological samples, were 100% the antithesis of what I knew my tribe wanted. And I'm like, I'm not going to go down and ask these people to sign this document. And so it came to the point where I said, I'm going to have to end the study if this is what you want me to do. And OHSU wasn't willing to go to that far. And so they sent the IRB chair to my office, and we worked on the HIPAA form so it was more appropriate for them. But I think that was the point, is I was willing to stand by the community first because and protect their interests. And it was something that went really far. And I think overall what I tried to do with mindfulness is tell people, look, this isn't about us, once again, prescribing something for these communities, how mindfulness can help you. It's more about what can Native communities, this is a time I think that Native culture can really be healing in a lot of ways. And so I'm like, how we want to inform the rest of the world how Native ways can lead to peace. And that's something that people could get behind, you know. Some of this was, you know, some of the considerations that I started to take into account, like what would I try to bring into these, you know, what are the Native traditions that I can bring into these different events? And so I'm always interested in what are the community strengths in that community. Like right now with Klamath Tribes, there's a big push on revitalization of culture, and they have several different events throughout the year that promote that culture, and so that's a huge strength. And so we've tried to do our best to become a part of that. And so is all of their efforts and our efforts in that community are all geared towards the same thing of reintroducing culture, of creating more Native cultural content to bring that sense of pride and knowledge that people get from being Klamath. And so we try to look at different ways, also urge people to stop thinking about, you know, because I have funding from National Institutes of Health, and I've written lots of different things for publications and papers and books and so on. So I've got that academic sort of, you know, what's the sign of success? I have that down in the academy, but what Native people are telling me is look at other signs of success, right? You know, not just about the money or whether or not you got the IRB done, but always looking to nature. And it's just great to keep thinking about how I can take an almost orthogonal view to how I normally do science and bring in this Native perspective in it. And it just gives me a whole new perspective. Looking to nature, you know, this Dene medicine woman who I had advised me on the Navajo study, who are Dene, she was the one that always told me to stop and look at nature, and nature will tell you if you're doing the right thing. And the other thing she always told me is that whenever you feel like you're completely losing your ground and you're just a little bit off balance, she says just to stop and to put your feet flat on the ground and just feel the energy rising up through the earth, through the soles of your feet. And it's interesting because until I actually just stop and do that, you're not paying attention to it, but it's happening all the time. And she was just like, and that's your recognition to come back to what is a true source of health and of power. And for her, that was the Dene way of health. Like I said before, we try to bring you more, like where we might have walking meditation in the meditation class. We're trying to bring in more dance, or even just doing a lot more, you know, different like tap, step that you might get in Native dance, just ways of bringing it in, whatever the group might think. So then you're doing like this mindful practice of like this mindful walking. So it might be good to have a pole or something to hold on to, because if you're just doing, and which is interesting, because if you're just doing the dance in the dance, you don't think about it, but when you slow down walking, it gets like really hard to do, you know. And so it's a really nice thing to be able to slow everything down and really think about each step that we take and think about each part of that in the dance. And we've done a lot of really nice job of bringing in, I think storytelling for me is a great way of, each week we'll have a theme. Like, so week one will be, there's more right with you than there's wrong with you, as long as you're breathing. And, you know, we kind of forget about that. And it's a whole kind of, that particular class will be around this, just be grateful you're breathing, you know, be happy. And that's a really good thing, you know, be happy about all that stuff. And that gives us an opportunity to be able to talk about a lot of issues around how we forget, you know, how valuable life is just in each moment, because we're so distracted by the past and the future. And so one of the ways, and so when we have that discussion, instead of having it as a lesson, we always try to figure out, is there a story? Is there a story that talks about that we can bring in and then have a discussion about the story? So we're doing that from the perspective of that story. And oftentimes they're going to be creation stories, or there'll be something about, if we're talking about things around even your own mind, that's a good place for coyote stories to come in. There's always ways that we can start bringing in these different stories and then use that as the lesson plan, for lack of a better word. So even if we're talking about, just taking care of your own body, whatever that tradition, there's a story about the importance of health and how that's how that's still created to create, or connected to creator, and bringing those things in. We work a lot, very hard all the time on I just, in every community I have, I'm really fortunate to have kind of a cloud of community healers that are advisors on the work that we do, and now over time become kind of part of the convoy in each community that we're in that are interested in these different issues. Because the goal is that ultimately, that when I'm done, I work with community members and train them to do these. We develop it together, then we train people to be the teachers of the course, and then we develop an infrastructure so the course can carry on, and then I leave, right? And then this is something that continues on in those communities moving forward. And so that's why we want to be able to develop this closer relationship with these people, because they're eventually they might end up being the teacher of the class. They might end up being the one who guides these courses and this programming forward in their communities, in their community health centers moving forward. So eventually, after all that work, I was able to receive a K99R00. So if anybody's interested in K Awards, you can send me a note and we'll talk about K Awards. But that was around developing an intervention to address diabetes, as I mentioned before. Diabetes came about because National Institutes of Health usually wants a disease associated with whatever you're doing. And my issue is that I would like to focus on dementia or cognitive function in later life, but I thought that might have been too provocative so early on with Native communities for me showing up and saying, I want to do late life brain health stuff. That gets people a little bit worried. But diabetes, every community wants to start working with, is happy to start doing something around diabetes. And so that was how I landed on that, which was interesting because I was in the Department of Neurology at the time, and they kept going, diabetes, why diabetes? I said, because eventually it leads to vascular dementia. And they're like, okay, we get it. So that's how I was able to get away with the diabetes proposal in the Department of Neurology. So anyways, and we've been doing that in Klamath Falls in Arcata, California. And in Klamath Falls, I'm working with the Klamath Tribes, specifically in Klamath Tribal Health, which services 4 nations that are related to each other: Modoc, Paiute, Klamath, and Washoukan. In Arcata, I'm working with United Indian Health Service, which services 9 tribes on the north coast of California. And what's interesting about that is that the Klamath tribes all have very similar cultural traditions that they're different, but now there's a recognized, like what they would use at powwow, for example. There's closer traditions, whereas in Arcata, all the way up to Smith River, the traditions there are all wildly different. And so it's interesting on how we're able to. So that made it an interesting case study, because with Klamath, we could focus in on one cultural tradition, but at UIHS, we can try to say, how do we deal with more than several different tribes who might have wildly different traditions? And that's been going great. And what I did early on too, because it was mindfulness-based stress reduction, MBSR, is run out of the Center for Mindfulness originally at UMass and now at Brown University, which is where I am. And the reason why I wanted to work with them is because they had spent decades developing this program, and I wanted to make sure that we had something that we were creating a program that was still consistent with MBSR, but at a certain point, it wouldn't be MBSR anymore. It would be Native mindfulness. And so I wanted them involved in the conversation. So I wanted as many voices, both from mindfulness and from Native traditions and from as many people talking about this as I could. And people were very excited about this project. And so, in fact, Brown hired me. They liked it so much. And these are some of the people, like I said, a lot of, how we make these interventions, we just take, mindfulness class and we put up some papers on the wall and we just started drawing what would it be, what would week 2 look like if we switch this out, we switch that out. And all these, we have tribal partners there. We've got some people from the Mindfulness Center. We just met up in a cabin in Trinidad, California for 2 days, and we just worked and we created the first intervention. And that's what we developed then. That's what we delivered to our we've done it twice now in both places. We've delivered the class, and each time we deliver it, we learn more. Like the participants tell us more about how to make it better and what they liked about it, what they didn't like about it, and then we take all that information, go back to Trinidad, and take all that down once again. Try to redo it. It's just this iterative process over time. This iterative, additive process. So I just want to say in conclusion, now we're at this point where this program is working in communities in Northern California and Southern Oregon, but also Carolina. I'm expanding out a lot in Oklahoma. I'm working with the chief medical officer, Chickasaw Tribal Nation, and we're going to be, and also some researchers at the University of Oklahoma. They took my research design and they're taking it and applying it to moms with gestational diabetes. And so that's called Native Mind GDM. And they're doing that in Chickasaw. So they're bringing in Chickasaw tradition and working particularly with moms just pre and post birth. And they want to see if that can have an effect on gestational diabetes. So this is expanding all over the country. So we're really excited about it. But I just want to keep going back to the main focus, I think, for doing this type of work is I always constantly have to be reassessing who I am, and I get this a lot from like Kate and thinking about being able to assess like how good of an instrument am I, right? And to the extent of like how valid is the data as it comes through me, is it still a representation of them? And I think that I just really encourage people who do this kind of work to focus on their own personal characteristics like gratitude and patience and acceptance and non-attachment. And these are all foundations for mindfulness practice. And so I think it's just as critical for people who are going to be researching mindfulness practice and always asking, am I worthy to receive this knowledge from these people? And that's I just keep asking myself, do I deserve to be here? This is a real privilege, I think, that people offer me. So I always encourage that Native people, and this goes for any sort of grant or proposal or programming for underserved communities, is that those people in those communities should have a really clear role of being a leader and highlighted that way at every turn, that everybody knows that. I always encourage people, if you're doing this, learn about the culture, understand the history as much as you can, and emphasize how much your research can contribute to the community. I tend to put together groups of advisors, so like 2 or 3 people that I can ask, really all that are very much allies that really want to see this project work. And I ask them about all kinds of things like, how is tribal council, or how long is it going to be until that health board can meet, and they'll give me the inside stick, because you're getting into a lot of like soap opera stuff on reservations. So I get to be able to not be, understand all the goings on in that community. And I also just be around those people as much as you can and just get to be a part of the community and part of the family, and all the time just showing gratitude. I think that's been the key to my success, and I just can't be more grateful. And Niue is thank you and goodbye in Mohawk, but it means more than just that. But it means thank you. It means I appreciate you giving me your time. Like, this is really what it means. I thank you very much. And I also want to thank some of these are my tribal partners, Hazen Upkick, Megan Warren, Chris Turner, Monica Yellowell, Andre Cramblett. These will all be names that you might see in the future, because they're my primary mindfulness teachers, and I'm hoping to get them out on the circuit teaching more Native people to become mindfulness teachers in their way. United Indian Health Service, National Institutes of Health, Drs. Carolyn Aldwin, Dessa Bergen-Seco, Barry Oken. Those are my primary mentors on this path here. Lynn Corbel and Susan Gaylord and Cheryl Woods-Giscombe, who are at University of North Carolina, who are doing similar research with diabetes, but with African Americans. So I do a lot of work with UNC Med School and those people in particular. So that's all I got. Thanks. If you have any questions. Actually, I have one more thing. This is I saw this at a slide. I stole this idea from a woman who came down from Indian Health Service in Alaska, and there was a tribe. This is an ambulance that some tribe had gotten from a local community. The community had thought that they were, low income hospital, so they wanted to bring them something, and they all pitched the money and got them an ambulance, and they brought it up there, and there was this whole big ceremony around giving them this ambulance, which is really generous and lovely, but it sits behind the thing because it turned out they didn't need an ambulance, right? And so one of the things that was really important is they never asked the tribe, what is it that you need? And so I think that's one of the things I want to ask people before you get into these communities, is finding out what is it that you need before we come and bring you the ambulance. So any questions? Yeah.
I am wondering how you reach the communities, because I was thinking, I see your community super sick and stressed. I don't know. So I was asking, I was wondering how you identify which communities and how they say, yes, we need that.
So the question was how to identify each community and get that first message out that I want to do that work there. Is that correct?
Yeah, and their approval.
And their approval. Yeah, I some of it was just location. Like Klamath Falls and United Indian Health Service was just because I was in Oregon, and they looked like and I just did some homework, and they looked like they had the right setup for a health system that I could work in. So, and they had the right population. And then I just drove there. The funny thing is that I didn't want to make that arrangement before I submitted the proposal, because if I didn't get the money, then, but then I got the money, and then I had to go down there and say, I got money, but you guys don't know it. I'm doing a study with you. So that was interesting. And so I just went there and said, I have money and want to do a study with you because this is what this proposal says. And they said, okay. And we went from there. A lot of times it's from now that we're doing more of this, it's from referrals from other communities that like to see this, that like the work that we do, or it's at presentations. I talk a lot on the circuits at diabetes conferences or at different places, and people just say, do you want to come work at our community at that point? Yeah, it's just a lot of cold calls, just finding, I think identifying other people in those communities that might have similar health behavior focused, public health focused, wellness kind of initiatives or programming that they have there, and just sending them a note and say, I've got this. Because most of those people, especially in behavioral health or not so much diabetes, but behavioral health, they're all going to know about mindfulness, and so say if there's a way that we can bring, we could do this big intervention. But one of the things that I'm doing is that a lot of the places I work with, like that, it might be counselors, don't want to teach an 8-week MBSR class, but there's ways that they could bring mindfulness into their treatment. So that's a lot of the other stuff that we work on. So instead of just teaching people to be 8-week-long mindfulness teachers, we can also say, here's how you teach breathing meditation for your people in your addictions group, or, and so that's also a nice part of it too. And that's how it's spreading out. So there aren't these big, you got to come to yoga class, as much as the staff is even more calm because they're doing the yoga class, or they're doing the meditation kind of thing. So finding people that might have an interest in seeing that happen in their health system is someone who I kind of send an email to and go from there.
Jeffrey, there's a similar question that you might be able to expand on. So from one of the attendees, what are the best steps to starting a conversation with tribal partners if there's no established relationship? Tribal health services, community leaders. So how do you start the conversation?
Yeah, so the question was, how do you start the conversation with tribal leaders if you don't already have an established relationship with them? And once again, I would say, I'll just use Oregon as an example. I would start with Indian Health Board in that area, because Indian Health Boards oversee, and this is just for Native people, but Indian Health Board oversees all of, in Northwest area, Indian Health Board oversees research and programming for all the Native tribes in Oregon. So they have the contacts, they know who the people are. And so it might be a good idea to contact the Indian Health Board and pass them their questions and say, I want to work in Warm Springs, or I want to work in Grand Ronde, and I have this proposal. Who would I contact there? So that's one good way to do it. And also just being able, like I just said before, is scanning, doing your homework of the personnel, people who are there, and somebody who might fit the characteristics of what you do or what you want to do best. That could be the person that you want to talk to. So if you have a really good diabetes intervention, you might want to contact the diabetes prevention program coordinator, right? And then get in with them. If you have an idea that might be around childcare, let's say, and you might want to contact the pediatrician there that works there. And then so find someone that might be an ally before you go to tribal council. Work small and then work your way up to tribal council, because that's how I do it. And then by the time I get to tribal council, all of the questions that they're going to ask me have already been answered, and I've got them all set to go. So when I go to present in front of tribal council, I've already met with 3 other groups of people who help me craft my presentation.
Any other questions?
I have kind of a comment in general.
Uh-huh.
So I'm reading that it seems like Native American communities are overstudied and oversampled. Is that your understanding, since you're like on the ground seeing this and participating, to come up against that, but they feel like, oh no, there's too many people contacting us?
It depends on the community. Like I said, Navajo, you can go out there and there's just researchers everywhere, going out with their clipboards and getting data. But the other places, not so much. So I think it depends on the Native community. I think in general, most Native communities don't have much contact with the academy. Now, the difference is that when they do have contact with the academy, it's much of a helicopter sort of approach. People swoop in and swoop out. That's very much what people are used to. And that's something that people don't like as much, and so if they feel like they're oversampled, maybe more of a frustration. I can't speak to any general thing, but from what I've understood from people is they just don't like the idea they're coming in, getting data and leaving, never even seeing the paper, or getting a call back from the researchers say, oh, we published the paper, you want to see it? And so what I try to do before I publish anything from these communities is I have them read through it. And in fact, we're going to be putting this one out in Klamath Falls, and all those people that you saw up there are going to be authors on it because they were significant contributors to the development of the course. But before it goes out, they're going to be able to read through all the results and our interpretations of it. So that way we make sure that when it gets out to the public, that it's exactly how it's supposed to be for how Klamath tribes are represented and the other tribes that we're working with. And I think that's critical before it goes out, right? Not letting them see the paper once it's been published, but before it goes out, having them give that influence.
And there's a follow-up question. Are there any publications by the mentors you shared that could help to differentiate between traditional MBSR and Native mindfulness practices?
Not yet. They're coming. So the question.
Actually, Tao Lee, she's been writing children's books around aloha and mindfulness. And that's widely distributed in Hawaii. I should give you.
I would love to see that.
Yeah, she's done a great job.
How many books?
She's done 2 books so far.
I want those books.
Okay.
She's and Tao Lee, who we're talking about. So I don't know. I'm about to. So the question was, are there any publications that can differentiate mindfulness from Native traditional practices? And we're just now putting out at least my papers that actually do specifically explore that. No other papers I think have done it as much. But she was saying that Tao Lee is. Who is a colleague of ours at the University of Hawaii, has a couple of children's books that look at particularly mindfulness and aloha as and so that was one suggestion. And Tao is, interestingly enough, is an author in a book that I have coming out this next February. We're working on, we have the proofs right now. It's called Beyond White Mindfulness, Critical Perspectives on Race and Well-Being. And what it does, and what we've done is found, we have 10 different authors from different communities, underserved communities that have brought their experiences of mindfulness, either programming, a lot of stuff around. One woman that created a mindfulness practice specifically for Black Lives Matter last year, and she talks about the creation of that and how she has these 17 minutes that are divided into 3 different sections, and the sections are touching upon specific trauma that's associated with how a lot of people saw what got them in the streets in the first place, and so she was saying that, and so it's a really nice discussion about those different traumas and those different psychosocial realities that go into developing that program of mindfulness. So anyways, that book's coming out in February, so there'll be a lot of, and then we have a chapter in there, and Tao's got a really nice chapter in it too.
And Lori McGraw had a question that's relevant,
Okay.
Which is, she's thanking you for sharing your important work with us. And it relates to Indigenous people who may not be affiliated with an official tribe but have experienced intergenerational trauma too. Have you created interventions for this group of people, for people who are located in the boundary land between two cultures?
Yeah, and we're focusing on more of that in North Carolina. I just got off of, so yes, Lori. Lori, there was that question that asked if there's not everybody's affiliated with a specific tribe or federally recognized, and that there may be people between cultures necessarily. So have we been able to develop something for them? And we're working on that now with the Lumbee tribe, which is a non-federally recognized tribe in Carolina. And I'm working with some people there at the School of Nursing at the University of North Carolina, Jada Brooks. She's a newly tenured assistant professor at University of North Carolina. And so we're working on that with them, but it's all just exploratory. I don't know how that's going to look. We're going to have to wait till more people tell us their experiences and how that looks.
Great. Well, I'm going to invite graduate students to stay and talk with Jeffrey. And the folks who are on Zoom can also stay and talk, and I'll keep monitoring this for him. But I want to thank Jeffrey for his talk.
Let me just go check in the dog again.
Okay.
See how she's doing.
I was a little worried about doing
Because you logged in as host. I logged in as the host, so I took over all the control.
There was a lot.
How many folks are still?
11 and drawing.
Yeah. So, and then we'll change them to panelists, so they.
Oh, great, okay.
So do you have all that to your
Yeah, I think I do. I'll text you if I don't, maybe just keep your phone.
Oh, phone's right here.
Okay. Let me make sure.
We're matching.
Oh, you mean?
Yeah, so.
That's where we're going back to, they were, okay. Office, what we were. Oh, well, I think they thought too, oh, it's 5 till.
Will be fine. Whatever.
Yeah, I wondered if you would. They're probably right.
Well, it'll just be more with people.
Yeah, I think, yeah, and I'll give him a base number.
I was just telling Carolyn, you're very.
Yeah.
He's passionate for his work.
Yeah. I wanted to ask him how much he thought that fact that he's made helps him develop these relationships.
I'm sure it's more informal than I can.
Yeah, see, I've always,
But I applied to it.
Well, I did, Alpert too.
of course. And
I don't think so. Do you want to come
I
out?
gotta go get that.
Yeah.
When you want, although I have to say, well, it's in the color. They always say.
Megan does have an espresso, but I don't.
I think they're.
Okay.
Yeah. Yeah.
That'd be awesome. Have them put like 4 pieces of ice.
So I guess
Oh,
we
okay.
could
So we're working out.
to make everybody.
Oh, you're kidding. Hi, Kate.
Yeah.
You were saying,
Yeah, you too. Totally. Nice to meet you. It's like-
Oh.
No, I thought about it too, like I saw it, because your emails come up on Yahoo. I never really-
It's been a long time since we
should tell them.
had to do anything.
There's so much going on. They made it here at 11:45.
I'll
Oh,
figure it
so
out.
to me, this is great. I'll be around, so if
Should I
there's
just look into
something
receipt or is
else.
this something I need to do?
So now people can actually answer.
So what, you know, in the
I'll
past,
be
it
here,
did
so-
kind of get it started for people, but I am not.
Yeah, because I have a bunch of, data. I'm at the end of my board and I have a bunch of in-person data. So
Oh my God, that's amazing.
I gotta be here to do that.
Yeah, I
so.
won't give you the left email and maybe I'll show you the brown email address.
It's easy.
Thanks.
Yeah, so I'm gonna ask folks to maybe help a little bit, because there's only a couple of us here, but there's
Oh,
a
yeah.
bunch online. So, and she's making them into panelists, so people
Oh, okay.
can talk.
They're gonna be able to ask questions.
Okay, Carolyn was saying something about maybe, Carolyn, what were you saying?
I'm gonna say, we've got like 10, 12 people online,
Okay.
and she's turning them into panelists.
Yeah.
Oh, nice. So that we can just chat.
Okay.
They can, yeah. you wanna
We
hear-
can almost make a circle.
Yeah, that's what I'm thinking.
All right, you guys.
Thank
Thank
you.
you, that was wonderful,
Oh,
I really
okay.
appreciate it. I did have a question, which was, that do you feel like because you're Native, it's easier?
Yes.
Yeah.
Oh, yeah, I'm everyone's grandkid.
I know, and that's a plus.
Yeah.
And that's why I think more.
We probably should have you still use the mic so people on Zoom can hear you. Sorry about that.
We can
There's
bring
no
it over
format
here.
over
I
here.
can get it, I'll see if you can get it over there.
Thanks. Yeah, I mean, that makes a big
We need to get
difference.
more people trained in academia to work with communities from the community.
Yeah. I think that's kind of the goal, and I think a lot of it too is just getting more people from there to be, get their degrees. And
Yeah, that's exactly right.
And OHSU's been doing a nice job with that. I was talking about it before. They were focusing on getting more students into med school, to go to OHSU med school, Native students. And so they've been doing this whole lifelong developmental program where they're working in the schools and with different families and providing like a handful of kids all of these different experiences throughout their whole educational experience that would kind of match like what people from more privileged communities or people
Yeah.
who might grow up in households of physicians might also get. So they're getting that. So hopefully the idea is if they get some of the same psychosocial privileges that other people get, maybe it's more likelihood to. So anyway, as long as it's a nice program that that's the whole idea is just get more Native physicians.
That's great. That's so cool.
And you're like, well, how do you get Native physicians? I worked on a diversity committee in the neurology department, and they were focused on African American neurologists. And I was like, is there an African American neurologist? Are there any that are choosing to go to residency in neurology? I don't know. So I was like, this is going to be a hard one. And then to get them to go to Portland, of all places, like, not like Emory or someplace,
Yeah,
It's like,
yeah.
I don't know, that was kind of funny. But anyways, the whole point, I think that's, to me, the biggest goal is just how can you train up as many people from those communities as possible.
That's absolutely the answer. Yep, okay, you guys, have a good discussion. Thanks again, Jeff, I appreciate it.
So how
Okay, bye.
Most of them promoted, but I think they have to accept on their end, because I remember that from before. But we've got several that have, whoops, I should delete them. Maybe that's what's happening. Or maybe I.
Yeah. So, what's up? What year are you?
So I'm a first year, I started.
First year grad student.
In psychology.
Okay. Yeah, that's right.
So yeah, I'm curious about, I heard you say something about that you were in psychology and then moved to public health, and I'm kind of curious about what happened.
Well,
Did
no,
you
I'm
have two
still,
separate
I'm still a
degrees, or-
psychologist,
Okay.
but
And he was in the human development program.
yeah.
Okay.
Yeah, it's an HCFS, so it was a combination, but I still identify as a psychologist. But I think the reason I went to HCFS is because I was a psychology major, and I thought psychology was short in some areas, particularly how they dealt with sociological influences. And I was like, there's much more they could do with this. So HCFS made it much more sense, because being able to blend in and marry and like being able to model and conceptualize psychological health, but also with the influence of society and other different factors that and developmental processes that lead all into that. So I think that given that there's a lot of public health in there. For me, it's very much a health focus, I think. So there's a lot of medicine, and so I didn't go somewhere else. I just kept adding things into it, and expanding out my skill
When you
sets.
say adding things, adding into your degree program through the process?
Well, no, then I went to, so I came, I did psychology, I built out into HCFS and expanded out. And then I'm realizing that I needed to have more of because I do my work, I guess is in a lot of cases translational. So I want to take the research that I do and be able to translate that into a clinical outcome, right? Or some kind of clinical practice. So I wanted to work in a place where people were doing that. So I went to OHSU. So instead of like adding that to my program, I just went to the med school and I started working with them doing what I do, but then learning how they incorporate, how they use medicine to do their work and how psychology can influence that.
Yeah.
So I just kind of, and then, then my postdoc, so each place I went to was the training environment itself was what I chose. It wasn't that what I did in the training. It was like, where did I go? What did I do to get
And
that?
then,
So
yes, then there's.
coming out, and when I came here, it wasn't full
So
public
they
health
did,
at the
when
time. They were
promote
just starting
diplomas,
that.
but I allowed them to talk.
So I didn't know at the time, and so that just worked out to my benefit, that I happened to have to take in public health courses seriously, not just that, like to get my degree, I had to really know this stuff.
Jeffrey, you might need to use the mic more. So I would like to bring in just folks who are online
Yeah.
and ask them to introduce themselves.
Let's see if this works.
You can try to changing it from presenter from the screen to changing it to grid view. So that
Yeah,
you can see everyone.
That's a good idea.
Oh, we can see it up on the screen.
It should be, if you stop sharing screen.
But I think I also have to.
I don't know, does that make sense? Because like, I would think that, I don't know, we can stay in touch and move along, because it's the first year.
Yes,
There's a lot of time to
stop sharing.
figure out how everything's gonna come together, where you want to go. But, as you do, certainly reach out, Oh, yeah.
Can I ask a question?
Sure.
Am I interrupting?
No, you're fine.
So we've been talking, I'm taking that course in the HCFS program, and I'm teaching qualitative methods. We've been talking, of course, about engaged research, but also the issue of, and I'm an ethnographer, so that's another time-intensive approach. How does the academy give credit for all that lead-up work that often discourages many folks who really are oriented towards doing community-based work from doing it, because it's going to take so long before you start to get the things that count. You seem like you've navigated it. You've got the funding thing and you've got the pubs coming out, but
I think some of it is you gotta commit. So I had to talk to doing the steps that I'm taking and saying, this is really the only way that we can do this. Unpack all of these things. And it made sense to them because they've been having difficulty getting these answers. And I said, well, maybe if we did it this way, we might get some better answers. But the thing is that it's not NIH that has a problem with it, it's my institution.
Yes.
And so, so luckily it just turned out that Brown, I just thought I was gonna get fired after 5 years.
I was gonna say, you haven't met these particular.
Yeah, it's like, all right,
This many pubs per year.
Fun having you, but you gotta move on. But now, Brown actually has on the faculty activity report, there's a whole page on community-based activities. because that's the school's big thing. So I'm just gonna lean on that. It's like, I am your communicator guy. But
I'm gonna be a little more mindful of folks in that, so
okay.
maybe, so I think you need the mic. So that
I didn't know, everybody's up. Can you hear me okay? Okay,
you guys
great.
want to introduce
They're nodding
yourselves?
their heads, I think, at least some of
Yeah.
them.
Yeah, do you want to introduce yourselves? Maybe we should pick, can you see?
How about Vicki?
Vicki.
Hi, I'm Vicki Cholerberg. I've recently retired from the School of Writing, Literature, and Film. And for almost 20 years, I developed and taught a writing workshop for thesis and dissertation writers. And I started incorporating mindfulness training for these, and they had to be ready to write. These were late career graduate students, and they really enjoyed that. And I had a few Native graduate students, and I find what you're saying so interesting. And I wish I had known more of this when I was when I had those students in my class. So I wanted to thank you for this. And my other connection and reason for coming is that I'm still on the steering committee for the Contemplative Studies Initiative at OSU. So I think CSI partially sponsored this talk. So that's where I heard about it. So thank you for coming in, and I'm glad to be able to join.
Oh, thank you so much. Yeah, Kate was here.
Yeah.
She still is.
Oh, the other Kate.
The other Kate.
Oh.
Kate. Maybe I told her I'd maybe come and do something with contemplative studies at some point. So I'm in Oregon for a while. So
Okay, that would be great.
I can't see.
Oh, there's Beth, is there?
Beth?
And we can wave.
Hi, Kate.
Hi, Beth.
You can? Oh.
Do you want to introduce
Other
yourself?
Oh, I see. Can you see me?
Yes, hi.
Okay, hi.
My name's Beth. I'm a first-year PhD student in Human Development and Family Studies. I'm actually taking qualitative methods this first term, and so it was really neat to be able to connect some of what we've talked about in class to the work that you were describing. So thank you so much for sharing.
Yeah, thank you. No, yeah, this is, Dr. McTavish certainly has been a big influence on all of this work that I do. So yeah, pay attention.
I did have one question for you, if I may.
Yeah.
You had talked about working in Arcata, California. And there's the HSU is over there, and they do quite a bit of work with the different tribes in the area. So did you collaborate with the university as well, or just individuals in the tribes?
Just the individuals in the tribe. I reached out to a couple people there, and I'm friendly with those folks at HSU, but we've never really done anything together. They just seem really busy. They're supportive, but faculty people.
Yeah.
Busy. Thank you.
So Jason, are you able to talk? I tried to promote you to a panelist, and I also tried to make it so that you could talk.